I'm going to go down the list. We have Chiara Orlandi, who's going to do the presentation, but also on the panel, we have Darryl Zeldin, MD, physician. He's from Chapel Hill, North Carolina. Lara Vaz, Dr. Lara Vaz, who's a PhD in public health from DC. Dr. Nina Yamanis, who's a PhD in public health from New York City. And Dr. Thomas Finch with his famous post that triggered an avalanche of responses and, is making very responsible posts for people to be mindful of everything that's going on. Me, I'm Raj, I'm in Baltimore, and I'm just lucky to have a lot of intelligent friends that are beating sense into me one way or another. My job here is to get people together and let them talk, and my other friends ask questions. So Lara, please take it away.
Great, thank you, Ram. Raj, sorry, I've also wanted to just let people know that we've got Dr. Ram Subbaram on, which is why I confused the Ram and the Raj. And Dr. Ram is actually at Tufts and is an infectious disease specialist, so he's going to be able to provide us some insight in terms of what he's seeing in the hospitals, but then also just likely just reinforce and add information to what Darryl, Nina, Thomas, Chiara, and myself are able to input. So with that, take it away, Chiara, it's all yours.
Hi, my name is Chiara. So let me just share my screen 1 second. So what we are going to do today is to give you a brief collection of information that are very important to know during this outbreak of coronavirus. And so I will start with some key points and take off messages that are very, very important to keep in mind. And then I will switch to give you some more detail about how the coronavirus is, how it's spreading, and what are the symptoms. And then I will open up the conversation among us. We identify some very important key take-home messages that we all have to keep in mind. And we are all trying to address these and deliver these messages during this call. First one is that the situation, especially I'm talking about the situation here in the US for now, is probably going to get worse in the next few days and the next few weeks. And before it will get better. What is the reason why this is happening? It's because right now, we don't have a clear picture of how the outbreaks of coronavirus it's here in the US right now. So we cannot predict with being sure and predict in details how the outbreak will develop in the future. Second, so just let's try to coordinate each other and help each other to slow down the outbreak. And if we don't see the results right now, it doesn't mean that it's not working. It just means that the results will come after. What is the best way of helping each other slowing down the outbreak? It's social distancing. What is social distancing? It's just keeping at least 3 or 6 feet of distance between people, such that we are actually not allowing the virus to infect each other. Why this is very, very important? To answer the question, I'm actually using this graph that I put on the right side, and I'm very sure that you guys, every one of you, came across this curve many times in the social media, in the newspaper, in the past few days. Well, let me go through this graph for you, and I will explain what does it mean. Here we have the representation, the graphical representation of 2 different outbreaks, the orange one and the blue one. What is the difference? In the orange one, we have a daily number of infection that is increasing and is very high in a very small, in a very short time. So what is the problem of this curve in orange? The problem is that we will have a very high number of infected people in a very short time period. And this will overwhelm all the hospitals and the health system. The hospital will have a lot of people coming in, and the number of doctors that is there and available right now will not be able to take a good care of all this overwhelming number of infected people in a very short time. So we do not want to be the orange curve. What we want to be is the blue curve. In the blue curve, we are putting in place a certain measure, such as the social distancing, in which we are actually slowing down the number of people that are getting infected every day, such that maybe we'll reach the same number of infection overall, but this will be distributed in a very longer period of time, such that the hospital will have doctor able to helping you every day, but helping 10 people instead of 500 people for each day, which makes a very huge difference. We have in the recent situation, we have a perfect example of the orange curve, which is we do not want to recreate, which is the example of Italy. And I will go through that later on. Another key point that we identify to be very, very important, especially for the audience of today, is that dancers are at higher risk in the population. Why? Because we are always in contact. We have a physical contact that is the key point of dancing with someone, and I'm a dancer myself. So if during the dancing in a big festival or in a small room with 10 people, we get in contact with someone that is infected, we can get sick. But not only that, the situation will get worse because we can spread the virus across all our families and friends. So it's not the problem. We have to think in the big picture, not helping each other in a big picture. So another point is, do not panic. We can, if we work together, we can make it. Be responsible, make daily adjustments, be creative. But we can, if we really coordinate each other, we can do it. These are the main point. Now, we will go back to these points later on in the discussion, but let me just show you what is the situation right now in the world. As of March 11, the World Health Organization actually declared the coronavirus COVID-19 outbreak a global pandemic. What does it mean? It means that it's prevalent all over the world. In fact, as you can see here from this picture, most of the world, the country of the world, they are defining white, which means that they are actually having reported case of infection right now. And if you notice, most of the states and the countries, they are actually white. What is the situation in the US? This is a visual representation of the spread in the past 7 days. And I just want to highlight 7 days. 7 days ago, March 6, the number of states that actually reported infection was 18. Just 5 days after, or 6 days after, we went from 18 to 36 states. Yesterday, in the situation here on the bottom right, we had 49 states in the US that were reporting cases. What does that mean? This spread is exponential. Most of the states in the US are actually currently experiencing an outbreak of virus. As I said before, the numbers of reports of cases here in the US are currently not representing very clearly the spread of the virus because of different reasons. And we will go back to that in the discussion. There have been some studies where they try to project the exponential growth of the number of countries in the US that showed virus compared to other spread in our countries. And as you can see here, US, which is the pink line, is actually showing a very, very similar trend to Italy, which is this one, this curve, and Iran, this curve. And as I said before, Italy and Iran are the worst cases in this outbreak because they showed a very overwhelmed sign of hospitals, which was the worst case that could happen. So that's why we are saying the situation will get worse in the US before it will get better. Most of the time, what I heard and what everyone heard in the population is that people are actually comparing influenza with coronavirus. And they're actually saying, yes, coronavirus is like a flu. It is not. And here I'm showing you why. Influenza, the flu virus, is actually able to infect deep in the lung, in the lower respiratory tract here, while the coronavirus is actually able to infect epithelial cells in the deeper part of the lungs. In those structures that are called alveoli, that are basically the structure that allows the blood to load oxygens. So basically they are actually helping us breathing. There are a couple of main difference between flu and coronavirus. When the virus that cause the flu is not a brand new virus. We have flu every year. So we retain a partial immunity every year. We also have some drugs that are actually helping containing the complication and the symptoms. And also, more important, we have a vaccine that we develop every single year to protect the population. This is absolutely not the case with coronavirus. Coronavirus is a brand new virus. We have never seen that before. We have no immunity that can protect us from this virus. We have no drugs, and most important, we do not have a vaccine, and the vaccine will come in probably 1 year. So it's not something that we can count on. Another major difference is that it regards the complication of the two diseases. After the influenza, if you have complication, most likely you have pneumonia, which is a bacterial, in this case, in the case of influenza, is a bacterial infection. What we have, which are our weapons against pneumonia, bacterial pneumonia, antibiotics? We have those, they work. So if you have a flu and you have bacterial pneumonia, you can be cured. In the case of coronavirus, the pneumonia that develops in case of complication in infected patients, it has a viral nature. Against virus, antibiotics do not do anything. They are like water. So we do not have a vaccine to prevent it. We do not have drugs to treat it and to treat the complication of the coronavirus. So these are the major difference between influenza and coronavirus. What is the epidemiology of the coronavirus? Coronavirus can infect both children and adults. It seems like from recent studies that children tend not to show symptoms, even if they are infected, and they can transmit the virus to other people. In the case of adults, most of the adults, around 80%, they show mild symptoms. But a small percentage of adults that are infected, especially over the age of 60 or adults that are actually having pre-existing condition, they can have severe symptoms that can require hospitalization and the ICU. Now, these data are coming mainly from a study applied to some cases in China. And this is one of the possibility of how the outbreak will be happening in the US. But what if the US will be the famous orange curve that I showed you at the beginning? Like, for example, Italy. Italy did not act very fast in restricting measures. So in this case, I'm not going through all the numbers here. I just want to give you a message. In the case of Italy, on the orange curve of that of that graph at the beginning, we have infected people. Half of the infected people are hospitalized for weeks, and 10% of those are hospitalized in ICU, intubated. This is major. We do not want to get to this point because this has overwhelmed hospital in Italy and it will overwhelm hospitals here. So the key point of this is we have to coordinate each other, behave in a safe way that will not overwhelm, they will slow down the spread and will not overwhelm hospitals. Social distancing is the solution. Another interesting characteristic of the virus is that there's an incubation period between from the moment you get infected, there is day 0 here on the left side, and the moment where you actually show symptoms and are contagious. Usually it's an incubation time of 14 days with a peak at 5 days. What happened in the meantime, in this incubation, during the incubation period? Most of the people are asymptomatic, but this doesn't mean they cannot spread the virus. In principle, they are contagious. So this is a major thing that we have to keep in mind, especially as dancers, where we have a frequent contact with people. If we are dancing with someone that do not show symptoms, it doesn't mean that it's not contagious, because maybe this person got in contact with the virus 3 days ago and it's still in the incubation period and is contagious when we don't see it. So this is something that we have to keep in mind during this outbreak. Another thing is that coronavirus is very contagious. One person can infect from, in average, 1 to 3 people. This is an average. The actual data that are actually showing that can be 1 or it can be, I think, 3 or 4 people. So the spread can be very fast if you are in a context like, for example, a festival, dancing festival, or a big gathering of friends, because one person can infect many people. And also we have examples of what they call super spreader that can actually spread the virus more efficiently in a group of people. So what are the symptoms that we have to look up? Mainly it's fever, tiredness, cough is very important, and is very connected with difficulty of breathing. And this is the reason why we are, the virus is different from influenza, because it's getting deeper in the lungs, and that the lungs will have trouble breathing. These are the most common symptoms. Less commonly, we have ache, pains, nasal congestion, runny nose, and sore throat or diarrhea. How the coronavirus spread? There are basically the main way is respiratory droplets. This means that someone is coughing, the drop can being released by the person and can land either on someone, and in the case we have the first scenario, which is a spread from person to person, or can land on a surface that can be touched by someone else later on. The person that the recipient of the droplets at that, the contaminated droplets at that point, if can easily touch the mouth, the nose, the face, and at that point can get some chances of being infected. So what is the solution here? Again, social distancing is the main tool, the main weapon that currently you have. A 3-6 feet distance between people. Again, we have to wash our hands very frequently with soap or alcohol-based sanitizers. We have to avoid touching our face, nose, and ears. And if we cough or sneeze, we have to do it in a tissue or and just throw the tissue away and wash our hands. Since another middle, how can I say, another way to spread the virus is through surfaces. We have also to make sure that we wipe out the surfaces where people are actually leaning to more frequently. Like, for example, in a dancing festival, since I'm a dancer, I can picture there is this registration desk where an attendee can actually cough, is infected, or maybe doesn't show symptoms but is infected. The droplets will go on the registration desk, and then the next attendee that gets to check in will just, I don't know, maybe lean on the table, and that can actually help to spread the virus, can get actually infected. So we have to wipe up space and surfaces. So in other ways are, again, social distancing, home isolation, quarantine for if you are sick, and personal protective equipment, especially in the hospital if you are taking care of people that are infected. Last thing that I want to stress is that in the case, these are a bunch of points that came in our mind during a conversation that we previously had that are more applied to a dancing community. We, as of March 12, the state of Maryland, and I'm talking about state of Maryland because I'm personally in Maryland, so it's easier for me, but you guys have to translate that in for each state where you guys come from. The state of Maryland as of March 12 has banned mass gathering events. This is because they want to respect the social distances as being the best way to not to stop the spreading of the virus. In those states where the mass gathering events have not been banned yet, it's a good idea to prepare, to be prepared for more restrictive measure that will be applied maybe tomorrow or in a few days, and considering canceling or postponing events. Again, social distancing is the most effective way to stop the spread. Let's keep to point 2. In case of you are a dancing events organizer, you should consider about making plan B in case of cancellation or postponing of your events, get insurance that will probably help you in these kind of moments of emergency. Please, organizer, keep in mind a key point of traveling. If your festival or your event is in a low risk state, meaning that the state where you live doesn't have a lot of cases of infected people, it doesn't mean that you can take it easy. This is why, the reason why is because your attendees are traveling from outside your city, maybe your state, and maybe your country. So all these people are actually gathering to your events, but they're coming from different parts of the world, which are probably not as in the same situation where this, like you're sitting in that moment. Maybe the spread is way worse in that moment, and they are actually bringing the virus to you. And being a gathering of many people, this will help the spread so much. It's a perfect incubator for an outbreak. So be careful with that. Keep the travel in mind. Again, wash your hands with soap many times, as much as you can. Sterilize common space surfaces. If you are providing food, please serve it with gloves, but with those gloves, just serve food, don't touch around. If you happen to touch around, change your gloves. Or if you touch your head, your face, change your glove. Provide disposable cup of water that cannot be reused and mix up with people. Monitor symptoms as cough or fever. This is not the only way, but in case of asymptomatic infected people, it's kind of hard. But symptoms are something that you guys have to consider. And I'm sure other experts in the call will have more thoughts about this point. Again, you can have like flexible refund policy for people that are sick and do not want to attend your festival. Advertise in advance the extra hygiene policy and the symptoms monitoring, because you want your attendees and your staff and yourself to be on the same page before the event starts. Also, from an epidemiology point of view, it's better to have as much information as you can about your attendees, because if something happened during the festival, you are able to track down what happened and the infection, who got in contact with, and this. So, and this will probably be a good point of discussion later on. This is just list of trusted source of information that you can actually consult every day or whatever you need. And I brought the example of Maryland and Baltimore City because I live here, but please translate that to your state and city where you live. So we end here, and we are open up with questions, and the other expert in the call we will be very, very happy to answer any question that you guys can have.
Great, thank you very much, Chiara. I know that we already have at least one question on here, actually two. And so I'm going to start with the first question from David Bautista. And it's a question around the virus, on how long it actually stays on surface. So the question is, since the virus persists on surfaces for several days, is it possible for it to live on mail packages or items you get from a grocery store? And I think Charles is the one who chimed in, or Amazon for that matter. Nina, and actually I'm gonna put this to Nina and then to Darryl. Darryl's sitting also not just as a clinician, but over with the National Institutes of Environmental Health and Safety. And so I'm going to ask them both for clarifications or responses. And then I think some of us maybe chiming in as well.
Sure, I'm happy to take that. I think I read one study that it can live on cardboard, steel, and plastic for up to 3 days. But you know, that was, I think, in the laboratory, so I'm not sure how that affects things in real life. But I personally am gonna get a box and maybe open it with gloves or not touch it for 3 days. But Darryl, if you want to chime in on that question, you might have more information.
I mean, so the short answer is we don't know. Different studies have reported different lengths of of time that detectable virus has been on surfaces. You know, I think it's been detected as long as a couple of weeks on some surfaces. There's no question that the major mode of transmission is respiratory droplets. And so the likelihood of you getting infected by touching, you know, a mail package, for example, that was sent by Amazon is very much lower than the likelihood of you getting infected by, you know, coming in close contact with somebody who coughs or who sneezes or who touches you and then you touch your face. And so we have to put things into perspective. I wouldn't be worrying about mail packages and you know, touching surfaces and in areas, but we should be cleaning those surfaces relatively frequently to avoid that as a possibility.
Great, thank you, Darryl and Nina. We have a related question, which is about how long the virus remains viable in on surfaces without a host.
Again, we don't know. Certainly on the order of hours to day, you know, a few days is likely. It's probably not going to remain viable just because of the kind of virus it is for much longer than that. Keep in mind, there's a difference between whether it's viable and can cause infection versus whether it's detectable by very sensitive methods. You may be able to detect it, but if it's not living, if it can't infect another organism, then it may not be as relevant. But again, a lot of these studies haven't been done yet, so better be safe than sorry. I mean, we're recommending that surfaces that are commonly used are, you know, wiped down at least once before an event or before, you know, every day, where, you know, most businesses are increasing cleaning crews and having them, you know, wipe down tables and so forth pretty regularly.
Great, thank you.
Laura, I think there was an earlier question about infectiousness and that Raj had asked that we address verbally.
Yep, sure.
So the one question was, how long can someone be infectious? And I would also be curious to hear Darryl's take on this, because I've been reading different studies, but
yeah. Actually, I'm wondering whether in Darryl, I'm going to pause for a second and allow you to grab a sip and actually ask Ram if he might be able to answer this question. Ram, are you unmuted?
Yeah, I'm unmuted. And the question exactly, I heard the second articulation of the question, but is it how long it remains infectious after someone sort of coughs out the droplets, or is it, again, going back to surfaces?
It was after a person is infected.
Okay, so how long do they stay infected?
How long do they remain infectious?
Yeah.
So I think, as with all of this information, it's very much a moving target, but I do know that for a lot of the patients that, you know, we've heard reports about monitoring in the US, just based on re-swabbing them with nasal PCR, which is the test that they use, they can continue to shed virus for days. And the exact duration of that, I mean, I'd be open to hearing from others. I think it's pretty hard to know how long that duration of infectiousness is. As you can see, a lot of things have gone with 14 days, whether it's for home quarantine or whether it's for other purposes. But certainly, you know, after someone's symptoms are better and after their fever is gone, even after that point, there's the possibility that they could be continuing to shed virus for a number of days. And that's really important to know. And it goes back to the question, to the issue of, one, there can be spread even before you have symptoms, but there's the possibility that there could be some transmission even after symptoms have resolved for some period of time.
Right. Ram, Dave has mentioned that he heard that the number of days was 5 after recovery. Could you just restate whether, or in terms of what you've heard, whether 5 seems to be an appropriate number, or might it be longer?
I think it could very well be longer, right? Because especially it depends on the individual's immune system, and it will be variable by individual. So for any given individual, they will shed virus for different amounts of time. And we know this even with influenza. There are people who have poor immune system who can have positive PCRs for influenza for weeks if they're immunocompromised, for example. And so So I think I wouldn't take any of those numbers. I'd take them with a big grain of salt if you read them somewhere. And I would just, keep in mind the possibility that even after someone's been diagnosed as having COVID, though, most likely they're not going to be diagnosed because we don't have adequate testing available in most settings. But even if, they are thought to have the infection, even after their resolution of fever and resolution of their cough, it should probably be some days before they are, freely interacting, certainly with substantial numbers of people, because they still could be shedding virus.
So we should note that the CDC is recommending 14 days of quarantine for anybody who has symptoms and has been shown to be positive. So I think 14 days, if you're going to pick a number, a safe number, I think 14 days is reasonable.
I would completely agree with that.
Yeah, so that's 14 days after symptoms first emerge.
Yeah, I think that's reasonable.
Yeah. Tied to that is the question, the clarification, can someone be contagious without showing symptoms?
Yes, they can be. I think one of the graphs that Chiara showed earlier, I mean, for the first few days, they're not contagious, but for the first few days, the virus is multiplying in the lungs. And so if they're coughing, they're going to potentially spread that virus. As the virus multiplies, it's going to reach some threshold above which symptoms are going to occur. And so they absolutely can be contagious and can spread the virus before they're symptomatic. That's the concern. And that's why that's in part why this virus has spread so rapidly within communities.
Right. Great. Thank you very much. The next question is actually one that I think I'm going to ask Ram to answer. As a hospitalist, what additional precautions should we take if we have to go to the hospital in the next few days, where we will definitely be more likely to encounter infected people? Do you have any recommendations for that?
So it depends on what you're seeking healthcare for. I will say right now in Boston, where we are right now, because we don't have enough tests available, if you have symptoms that are mild, that could be consistent with, COVID, for example, fever and cough, and it's mild and you're not someone with severe disease, we're actually telling you to stay home. And that is because we don't want you to come and potentially transmit the infection to others in the hospital if your disease is mild. And we don't actually, at least in Massachusetts right now, have enough testing for the vast majority of individuals who are coming in with symptoms. And hopefully that will change in the coming days. But the reality is, and I just want to layer this onto everything else that's been said, is that we don't have any idea of the scale of this epidemic because we are not testing enough people. And that includes places like Boston, where we have enormous healthcare infrastructure. And even patients in the hospital are not getting sufficiently tested. If you need to go to the hospital for some other reason, so one, if you're going for symptoms that could be consistent with flu-like symptoms, for example, that could be consistent with this infection, please call ahead to your primary care provider, or to someone, to hotlines that may be there at the hospital to talk to someone before you go in, because we don't want too many people in the hospital. We want to triage so that the right individuals are coming to the hospital who need appropriate help. And if you're going for other reasons, it's the same precautions. For example, if you have some other type of medical care that you need, it's the same precautions that you would do anywhere else, which is to be washing your hands regularly, keeping a safe distance from other individuals, including in waiting rooms, not congregating as much as you can in places where there are areas of high traffic. And that's how you can protect yourself as you're going to the hospital.
Sure. Raj, just I guess the clarification would be, if you have a scheduled outpatient procedure, surgical procedure, or something like that, would you just recommend at this point that you contact your provider and find out whether they would recommend it to be
all elective outpatient surgical procedures have been canceled at our hospital because we're anticipating so many individuals coming in the coming days. So we've actually, at Tufts Medical Center, most outpatient surgical procedures have been canceled because we are going to need those beds.
Okay, even if it is outpatient?
So we are actually doing half of our visits, outpatient visits, virtually now.
Okay.
to open up.
But I guess this is the issue, is it's a
Depending
procedure.
on your healthcare setting, I would definitely call ahead to see whether the hospital is still keeping those appointments or how they're modifying it in response to what's going on. Because there's a good possibility that they may be, as we're doing, canceling outpatient visits, making them virtual visits, or canceling outpatient procedures that are elective, because that's where things are moving right now. And it's changing on a day-by-day basis in every healthcare setting, depending on what you're seeing. So I would definitely call ahead for any outpatient visit that you have. And certainly if you're going to a crowded hospital with symptoms, please call ahead before you do that so that they can triage you appropriately.
Sure. Next series of questions. One is around from a public health perspective. If the area only recommends canceling and is only recommending canceling and is not banning them, for example, a nightclub, what would you recommend? And what about smaller group classes? Are shine classes, and for those who are the non-dance community, shine classes are ones where we're not partnered up, we're working more on footwork or drills. And the reason behind this question is that they've noticed that some people are still hosting small classes or private lessons. Is that okay? Nina?
Personally, I think it depends on your comfort with risk at this point. I don't know if others would agree, but given that people can be asymptomatic and transmit it, and in fact may be transmitting or maybe shedding quite a bit of virus in the beginning, in the first few days, are you comfortable with that? Are you comfortable if somebody has it or not? Personally, I'm not. We're isolating ourselves as a family. So, but others may want to comment on that.
Yeah, I'm gonna, Darryl, Ram.
Yeah, so I mean, I think privates can continue. I think small groups with distancing, social distancing, with emphasis on doing things like shines and other kinds of things which don't involve physical contact can probably continue. Again, we're trying to minimize large-scale transmission, and so the worst thing you can do is host an event with more than 25 or 50 people, because then one infected person is going to affect a large number, and we're trying to convert that that peak curve to the flat curve. But yeah, I mean, I'm certainly going to the grocery store. I'm continuing to live my life. I'm just avoiding any events with more than a certain number of people. I think 25 to 50 is probably the upper end that I would feel comfortable with, and that's what most businesses, most organizations are. I mean, they're canceling seminars or meetings with more than that number of people. So yeah, that's my opinion.
Ram?
I mean, I think this is very much a moving target. I agree with I would say even at the lower limit, I would take the lowest number, which is 25. I really don't think we should be congregating with more than 25 people at this point. And I would just point, I think the most notable graph to me as a healthcare provider, as well as someone who's an infectious disease epidemiologist, is that graph that showed that we're on the trajectory that Italy is on. And I think that's really, really, really important, because Italy right now, people are dying in hallways because they don't have access to ventilators. That's actually going on right now. That there are that many people in the hospital who are critically ill, and they don't have the resources to manage it. And physicians are working 7 days a week, and they're often working, without nonstop, without sleeping, because they don't have enough providers. They're sending orthopedist physicians to manage, patients in intensive care units, which is something they shouldn't be doing at all. That's the situation they're in. And the reason for that is they didn't take seriously enough the need to not, to eliminate any congregate settings where you can possibly do so. And my personal opinion is we need to be moving towards that as quickly as we possibly can if we're going to avoid that, because we're right on that curve. We're right along that line that Italy is on. And unless people take it seriously and they really shut down any events that we can, and this really extends to businesses, to organizations like yours, take on that responsibility and that public health responsibility we all have right now, at least until we know what's going on with adequate testing. And so I would say 25 is really the upper limit. I would say if you can possibly cancel, avoid practices, avoid any events, I would do it at all costs. I mean, even if it's smaller numbers, that's my personal opinion, because if we don't bend that curve down, our hospitals are really going to be overrun within days. And right now, we're, I think, 11.5 days behind Italy, based on that graph that was shown, and other estimates. So we are not far away from that type of situation happening in this country and many places in this country.
Yeah, thank you, Ram. Yes, please go ahead.
Sorry, I just wanted to add one thing, which is that some cases of countries that have done well with this epidemic, like Taiwan and Singapore and South Korea, take social distancing very seriously. My in-laws live in South Korea. They get their groceries delivered. They don't leave the house except for a walk every day. They take drives to entertain themselves. So it's, and they still have cases in South Korea. So, but the kids aren't playing in playgrounds. The playgrounds are empty. So I take that as a sign that we need to do something similar to them.
Yeah, I think sometimes it's hard because when we see no progression, we wonder whether it was worth the caution. But the best evidence of success is no progression or slower progression, and that things aren't as bad as they seem. I think there are two questions related to the number of size. And one is how long do we think that we should hold off restarting events with 25 people or more? And why are we saying groups of 15 are okay?
So this is Darryl. So I think the short answer is we don't know. I think at where I work at the National Institutes of Health, we're canceling events for 45 days out now, but we're reassessing things at about 30 days. And so I think this is the kind of thing where we should cancel a month and a half out and then reassess where things are towards the end of that and decide whether to extend. A lot will depend on which curve we're on. If we're on the Italy curve, then we may have to extend it. If we're on the South Korea curve, we may be able to start things up sooner than later. So I think cancel short term now and then reassess is what my recommendation would be.
Yeah, I guess it goes back to that whole question about how do we flatten that curve and how do we go from here to like maybe here, and how quickly we can go to there. And how quickly we can get to here may give us a sense of how quickly we can open back up, but that may mean more caution now to be able to open things up later. Thomas, you wanted to add something as well?
Yeah, I had a thought that I think leads back into a question for I think for several people, but so far in New York, I think a lot of people have made decisions to try to cancel everything, including their group classes. And something I'm actually sort of actively grappling with is how extreme we have to be. For example, we know from like the Spanish flu of a century ago that the sooner you did something, the more lives were saved. So different cities that shut things down at different times had different mortality rates. So kind of following off Ram's point, I guess I'm wondering, should we not just go with extreme caution at this point? Not at the risk of panicking and things like that, but can we even actually do enough? And therefore, should we be just doing everything we can right now? So if you can afford to not have classes of any kind, is that maybe not the wisest path forward? It certainly appeals to me from a risk perspective, but I don't know for sure. And I think it is such an evolving situation. And I do also worry about, if you may think your community is low risk, but we don't really know because of testing right now. So those are some things I'm trying to grapple with, and I would kind of appreciate what some people have to say about that.
Great. Darryl, Nina, Ram, does anybody have anything to add? Or
Better safe than sorry. Again, I think, private lessons with 1 or 2 people in a large room where you're keeping social distancing is probably okay. But if that, but you're not at zero risk. I mean, to be at zero risk, you'd have to stay in your house, in your room with 0 contact. And, that may not be possible for some individuals, but better safe than sorry. I mean, I agree with Tom and Ram and the others.
great. I think the question
Could I
of
just add one thing here?
yes, please, Ram, go ahead.
I think the point that was made that we have no idea what's going on because we don't have testing is really important, because if this change with a lot of the regulatory processes that have slowed things down and are in normal circumstances are very appropriate, allows rapid expansion of testing in the coming weeks, we may have a better grasp on the number of cases and how much community transmission and where, and be able to make more educated choices. From everything I've seen from our testing crisis right now, we have no clue whatsoever. And I can say that with confidence, at least where I am. And I could probably with much of the country, how many cases there are. What we do know is with the little testing that we have, and it's remarkably behind pretty much every other advanced country in the number of tests, we are right on those curves, even though we're substantially underdiagnosing cases. And so what that means is, taking a more cautious approach now, even with smaller groups, makes a lot of sense, because within weeks, 4 to 6 weeks from now, we may have a better grasp of what's going on. But right now, if we're looking at the epidemiological evidence available, I really don't want people to be dying in my hallways because they don't have a ventilator, and that's where we're heading. And so I would encourage everyone to take that very seriously, even though it feels very theoretical. But this is an infectious disease that increases exponentially and for which we haven't had testing, so we don't know what's out there. So while it feels very it feels surreal in a way, I think, for everyone, like the decisions that everyone's taking, it's driven by real evidence and real knowledge of how these social distancing strategies work. And we should really all be engaging in that now while we can prevent some worse outcomes.
Yeah, thank you. Nina, do you have anything else to add to this? Chiara? Yeah, I think we've got several other questions tied to just the curve and the spread. I wish that I had Alan Lebrique on, because he's been posting like mad, and based at Hopkins has also been pretty heavily engaged in doing some of the tracking of these curves. But does anybody on this call know how Spain or the curves for Spain or France look like compared to Italy? Given that Spain and France have just shut down as well.
Aren't they basically the same?
I'm assuming that they're similar,
I think
but I
kind of
don't
track.
Yeah, I don't.
Europe and US all kind of looked similar on the last graph I looked at.
Yeah.
That's right. The only outlier country that wasn't Singapore or Taiwan that are smaller countries was Japan, which has a notably different curve from everyone else.
Oh, I was going to add something about small group classes. So South Korea also, they had been having students having extracurricular activities for a while during that epidemic, and they recently shut all of that down. So they no longer doing like one-on-one tutoring. I'm just sharing because they're ahead of us. So this is maybe what we're going to see here. Yeah.
Thank you. I know that I have several questions here, 5. So first one is around travel. I have travel coming up. I ordered face masks from a US company, but the masks are apparently made in China. Should I disinfect the masks before using them?
Yeah, answer is no. There are certain masks that work well and certain masks that don't work well. And the ones that the CDC recommends are N95 masks. So they're more tight-fitting masks. Just wearing your standard mask like you would buy in Home Depot or Lowe's that has a lot of air opportunities for those are not going to work as well. So N95 masks are the way to, and most are made in China, but I think it's fine. They're made under conditions where they're unlikely to spread the virus.
And if they're not N95 masks and just masks?
CDC recommends N95 masks. So the other point is, if you're symptomatic and you want to avoid spread, you should wear the mask. Right now, CDC is not recommending that people wear masks, to go about their daily living activities.
Whoops, you've just gone on mute.
I'm not wearing a mask when I go to work. I'm not wearing a mask when I go to the grocery store. CDC is not recommending masks to prevent getting the disease unless they are recommending masks for people who are symptomatic to avoid spreading the disease. And for healthcare workers that are likely to be in contact with people who have the disease.
Great.
I'm going to add to that too. Anecdotally, I know several of the hospitals in New York are anxious about not having a lot of masks. So I don't have enough knowledge of how supply chains work, but my bias, if at all possible, would be to save the masks for people who are going to be exposed. So if it's possible to not travel or to not need masks on a personal level, that would be better, because healthcare workers are going to be so much more exposed to contagion compared to the average person.
Yeah, I know that LA is facing similar issues already. And even just for N95 masks, I know that folks working in TB labs in Peru are having difficulty actually gaining access to masks. And these are people, N95 masks, and these are people who really do need those masks. So consider that when you're looking at masks and whether or not you need to get them and to what extent they're going to protect you or others.
Jason just made a really good point too, that they have to fit properly. It's been a while since I've had to do this, but when you wear them, you have to test fit them and you have to go through a whole process. Having a beard can complicate things. So you may be buying something that isn't even fitting correctly, and then you're getting almost no benefit out of it.
Yeah, great. So I have a few questions that are tied to infectivity, seasonality, and drugs. And so I'm going to pull them together because I think that will help us with this discussion a little bit. The first one is I've seen that heat is helpful to slow down the virus. Will summer help to make it die down? And then two related questions around treatment and vaccines. Is there a timeline for vaccines and cures? Why do we not have cures and vaccines at this time? And are antiretrovirals such as Tamiflu effective in treating COVID? I'm going to turn these questions to our clinicians. Ram, do you want to start? And then Darryl.
Okay, so a number of questions there. Seasonality, the easy answer is we don't know. Many viruses are seasonal. And some of that has to do with humidity. A lot of that has to do with the number of people in congregate settings in any given time. We tend to stay more indoors during cold seasons. So both of those potentially play into the seasonality of things like the flu and our normal respiratory viruses. And that's why we see peaks in winter and they go down, and generally they're much lower in summer. There is vague hope that, that could play into the dynamics of this infection, but we really have no idea. So I wouldn't put a lot of hope into seasonality, saving us from this. And even if seasonality does temporarily protect us, there's a good chance that there would be a resurgence of the infection, the next season, if it's still circulating in the population, which would be very likely until we have a vaccine, which brings me to that question. vaccines take time. And, I know despite what our president has said, it will take time. And on the fastest sort of time window, what Tony Fauci, who's head of the National Institutes of Allergy and Infectious Disease, was saying was really looking on the order of a year to year and a half in the very best case scenario, I would say. So I wouldn't look to a vaccine appearing, in the coming months to really help us with this, though you can never say never, right? And I'm sure at the National Institutes of Health, they are committing resources very substantially to this now as quickly as they possibly can to get people working on this. And then the third thing is Tamiflu definitely doesn't work for this virus. There are other medications, including one that's used for HIV that's being tried out in these cases, for which there's some experience in other countries that, is hard to really interpret at this time. There's also another medication that for off-label use that can be obtained for critically ill patients. We don't know how any of these work or whether they'll be effective at this time. So right now, I think the best, safest thing to say is that we don't have effective treatments, though we may find out that some existing medications may have some partial effectiveness as things go along.
Right. And I guess based on that, that's a further reason to knowing that we don't have treatment yet, and the best way to deal with this is prevention, and trying to reduce our risks of infection. Darryl, I know that you and I had a prior back and forth around seasonality. Did you want to add anything to that around the seasonality of this?
Yeah, so at least one of the countries, Singapore, has had significant local spread, and they're a pretty warm climate. I think the current thinking is that it's unlikely that the season, the warmth of that's coming to many parts of the U.S. is going to slow this thing down for sure. We just don't, but the short answer is we don't know. Which I think Ram emphasized. I would also want to emphasize, so NIH is starting early phase clinical trials now with several different drugs, but again, as Ram said, the data is not available yet. And not only is NIH, but other vaccine centers all across the US are working diligently on trying to develop a vaccine, which will probably not be available as suggested by Ram for the foreseeable future. So, yeah.
So I'm gonna take the prerogative right now as the facilitator and address Raj's latest question directly, and then open it up. Raj, your question about if there's no medication, no vaccine, what gives us hope? I think what gives us hope is that we've been able to identify this. We have better science than ever to be able to develop vaccines and fast track vaccine development, and we are already working very closely to be testing medications. What we need is time. So what gives us hope is actually being able to slow down the spread so that we have time to be able to respond to this. I hope that that is something that people really understand. It's not that this is a hopeless situation. We just need time to be able to better respond to this. And so the best thing that we can really provide for all of us and for those who are infected is a little bit of time. And the best way to buy time at this point is prevention. And part of that is the social distancing, but also it is washing our hands. It is cleaning surfaces. It is taking care of those who are maybe not going to be as healthy as we are. We know that this virus affects people differently. And so all risk is not the same. A healthy 5-year-old is going to respond differently than a 70-year-old with diabetes, hypertension, and obstructive pulmonary disease. So these are all things to take into consideration. And these are people that we interact with. There are children, there are nephews and nieces, there are parents and aunts and uncles. So we, as we are interacting as dancers, are also interacting with the larger world. And I think it would be different if we were just interacting with each other. I don't know if any of the others have something to add to that before I go back to the question.
I have just one little additional comment just in support of all of that. Just maybe I'm just reiterating it, but if you go back to the graph of flattening the curve, the bottom is time, right? So the greater gap, if you get infected 6 months from now, you have a small chance of a vaccine, probably not. But if you don't get infected for a year or more, maybe a vaccine becomes available. So, right, the hope is that, kind of what you said, that if we can delay this, then treatment, then vaccination can become available for people.
There was a very specific question about what products we should be using to clean porous surfaces besides Lysol and bleach. I'm looking to the ID folks.
So the CDC did put out some sort of public notice that covered a lot of common cleaners that we have. And I think the key message there is really something that contains bleach, which a lot of Lysol branded projects do. And I would just look at it, and if it says bleach, then that's probably a good surface cleaner to be using. My understanding of the molecular nature of this virus is that it's pretty decontaminated by our standard bleach products pretty well. Though I'd be open to hearing from others.
Lara,
Yes, Chiara.
In the slides, in one of the last slide, I actually had a link for the list of EPA-approved detergent and disinfectant for the coronavirus.
Great, thank you. Anything else? The next question I have, again, is how will we know that it's okay to start group events back up? And is there a difference in recommendations between indoor and outdoor events?
I think, as Darryl, I think we addressed the first issue earlier in the call. I think we need to just wait and see how things go. For now, I would cancel things for 30 to 45 days and then reassess. Difference between indoor and outdoor, obviously outdoors you can have, there's going to be less chance for contamination just because you're going to have more social distancing. You're not going to be confined to an area. Things are not going to land on hard surfaces, which can be transmitted. Outdoors probably better than indoor. But dancing kazomba with somebody outdoors you still have the risk because you're right on top of them. So yeah.
Great. I'm actually going to open the line to people who are calling in for questions. Does anybody have any questions or comments?
I think all of the people that are on the phone, everyone's muted by default.
So they need to unmute themselves?
Yep.
Wonderful. Please unmute yourself and ask away.
Hey guys, so I have a question and someone else said the same thing. Here in Raleigh, it's been for a little while now. Most of the cleaners and detergents are gone off the shelf, just like the toilet paper. So what else do they recommend if, some people don't have access to that stuff?
Great, thanks, Jenny.
So to clean surfaces, just a little bit of bleach in water is going to be adequate. Jenny's right that you can't find any more hand sanitizer in most of the stores. You can make your own by putting rubbing alcohol with lotions. There are websites you can visit on how to do that. But yeah, they're at least around here, you can't get hand sanitizer.
No, some of the stores you can't get any cleaner either. The Walmart by my house, all of the laundry detergent and almost all of the disinfectant cleaner is completely wiped off the shelf. So I guess it's just very eye-opening to see, if there is a mass infection, that people are not even going to be able to have access to these cleaners to make sure surfaces are being properly cleaned. So.
Yeah, I mean, I guess one of the responses from my end is this is an unfortunate consequence of people buying far more than they're going to reasonably need and hoarding. And I think we all have a responsibility to take care of ourselves, but also think of others on this. So hopefully the stocks are going to come back in. Keep an eye out on your stores. Look at things online. I know, I think we're going to have to, hopefully this is going, and hopefully the prices are not going to skyrocket as a result of this. Jennifer Geyerman asked about if you've checked at like dollar store or ethnic stores. That might be like some of the smaller bodegas and things like that might actually have.
Mm-hmm. Yeah.
Even Amazon Prime is out of hand sanitizer.
Yeah, it's gone.
Yeah, but if we can find,
has been for weeks.
bleach, yeah.
I found some stuff at the AU, my American University store for students, because the students were on spring break. They had a bunch of stuff. I don't know if there's a university close by to you and they have a store and the students are on spring break and they're still open. They might have stuff.
Yeah, I'm trying to think. I have like plenty of supplies, not in a hoarding way, but I know, people are out, people are starting to panic. So I'm trying to be proactive and see what options they might have.
Yeah, I mean, I guess, go ahead.
PSA, don't substitute rubbing alcohol for hand sanitizer on a frequent basis. You will wreck your skin. I know a couple of people who've tried that. And actual soap and water does work. It doesn't have to be antibacterial soap. It doesn't have to be anything fancy, but actual soap and water still works, which is what I've started doing because I don't have a lot of hand sanitizer. I did not.
Another point the CDC is making is that washing your hands, you should do it for at least 20 seconds, both your palms and the back of your hands. So it needs to be 30 between your fingers exactly. So it's not just a matter of running a little bit of soap and water on your hands and you're done. 20 seconds minimum.
Well, Charles, if you're willing to sacrifice your Jack Daniels for clean hands, please go ahead and do that.
Could I also add in here? I mean,
yes.
I know there's a lot of fear from not having hand sanitizer or cleaning supplies, for example, but I think the risk from one, like you can wash your hands with soap and water, and that's actually recommended above, Purell based or Purell and other sort of hand sanitizers as a means of cleaning your hands. It's harder to do when you're out and about, which I think is the challenge that everyone faces. But even more than that is most of this is probably spread through direct contact and droplets, someone coughing on you, or, breathing on you or from that immediacy of contact. And again, that just speaks to the importance of social distancing and not thinking, we shouldn't fool ourselves into thinking that, okay, I got Purell and I'm doing it copiously, like all the time, anytime I have a chance, and that's going to protect you. That's not really the main protection. That is critical. But the main protection is not, being in contact with others who could transmit to you.
Yeah, I think that, there are lots of comments coming in around urban myths about making sanitizer out of pure vodka. Is that true? Is our cell phone a source of risk? Comments, Ram and Darryl?
Sure.
I wouldn't share the cell phone with other people. I'm not going to comment on urban myths. Again, the definitive site for information is the CDC site. They have very detailed information. They have appropriate links. There's lots of rumors going on out there. You should make sure that you trust the source of the information. I would not pay much attention to myths or rumors.
I have a comment as well. Maybe the first time I can actually be useful as a psychiatrist, but there's also going to be anxiety, right? And what Ram and Darryl are talking about is risk levels, right? That close contact with people is by far the riskiest. The environment, the external world is now risky in a different way than it was like 2 weeks ago. So yeah, the package could have some virus on it that comes from Amazon. We're not going to be able to take that completely to zero, and we're going to drive ourselves insane if we're trying to sanitize every little thing. So I think it's just something to be mindful of, that there are and this is where things like the CDC website are so important. There are actually concrete things that move the needle substantially. And at some point we're going to have to let a few more minor things go in our lives. Otherwise we're going to be completely insane and throwing bleach on everything that enters our house, which is not sustainable.
Yeah, and then we're going to run out of bleach. I think part of this is from a public health perspective, what we talk about in terms of risk reduction. So you want to try to take those measures that are going to bring the biggest reductions in risk that you're able to take. Some of us are, I'm lucky, fortunate enough to be able to work from home. And given that I was just out on the West Coast and in contact with people who were symptomatic and ran through the Seattle airport and was touching surfaces, I can telecommute. Not everybody can do that. So if you can't do that, what can you do? And I think that's part of why we are seeing, for those people who have to come into the office, we're trying to reduce the number of people that are sitting around a table in a room together. That's a risk reduction. If we have to, be going out and being in close contact with people, we can be washing our hands frequently. The clinicians do not have the luxury of just working from home and avoiding contact with sick people. And we're seeing reductions in the number of people who are working on wards, particularly, I know my sister's hospital has just seen all medical students and residents pulled off the infectious disease ward or out of the ICU entirely. So that just reduces the number of people that are there who are going to be able to help out in the hospital. And so we ought to be thinking about what are the things that we can do to limit the risk for ourselves, but that also contribute to limiting the risk to others. So Jason, you asked about canceling events for the next 45 days, but what about looking into planning events? Jason himself is planning events months, years in advance. Should we not be planning anything, or is there a time far enough ahead where we could be responsibly planning something?
I do the same. I plan events in advance as well. And the way I'm looking at it is if I can cancel an event without affecting too many attendees, then it's okay. But at this point, if I'm going to plan an event a year in advance, or I'm going to announce it right now versus 2 months from now, it doesn't make that much of a difference. But the backlash that I'm going to get from people if I announce an event right now is probably going to be much more. So I'm going to be a little bit calm about that and keep it on the DL for a few weeks or maybe a couple of months.
Okay, great. Any recommendations from the experts?
I can tell you at work we're rescheduling events to the fall, like September timeframe, as being safe. But again, we don't know, and so the hope is that over the next few weeks to months-ish, we will have more information and be able to advise more clearly.
Great. Thank you. Yeah.
I have a quick note for people that are on the phone. We said, you can ask your questions, but they were all on mute. To unmute yourself, please press *6, and then you can talk. And
yes. I know Thomas is about to drop off, and he wanted to respond to the questions that Kelly had about responding to people who are asking or commenting that this is just the flu and we're making too much about another.
Yeah. I'm curious what others have to say as well. I've been doing this a lot. I don't know why. Probably just out of restlessness. One thing is you may not convince them. They may be convinced it's the flu, so you have to be prepared to accept defeat. I have found a few things do seem to make people take notice. One is, okay, maybe it is like the flu, but now you have a second flu. Doesn't that concern you? But normally I tell them, listen, it's probably about 10 times deadlier than the flu. It puts a lot of people in the hospital. And what do you think happens if the hospitals are all full? Some combination of those pieces of information usually get some people interested. Some people are in denial. They don't want to believe it. They're into conspiracies. There's all sorts of stuff out there, and you're not going to convince those people, so don't waste your time on that. But I have found those things to have moved the needle for some people. You know, there's so many obvious ways it's not like the flu, so that's not what you're dealing with, right? You're dealing with people who just don't want it to be something serious.
Great, thank you.
Yeah.
Does anybody who's calling in have a question? Please unmute yourself, *6.
Hi, I'm Karen Wade, and I'm a nurse, and I noticed they want to push the hand washing, but as a nurse also, shorter nails also help you get your hands cleaner, and also not having fake nails because you can't get underneath the nails. Another question is the N95 mask that you mentioned. I know every year we have to get tested for fit tests to make sure that it does not go through. We use it for TB patients. Now, is the simple surgical mask going to work as well with this virus? Is the virus so small that it needs the N95 mask?
This is Darryl. Typical surgical masks are not going to work as well as N95 masks that are properly fitted.
Right, not work as well, but when people ask me they have a surgical mask available, would that be somewhat effective for them?
It may be better than nothing at all, but again, CDC is recommending the N95s for healthcare providers.
Okay, thank you.
Great. We had a question about how long do treatment trials take? Since we know vaccine trials are 12 to 18 months.
Yeah, so treatment trials have started, my understanding, just within the last week or so. You know, my guess is data will be available, you know, on the order of months. Clearly not on the order of weeks. So yeah, I mean, you know, again, CDC will post, and there'll be obviously you know, large-scale communication by Tony Fauci at NIAID that's overseeing a lot of this. So months, not weeks, but it'd probably be quicker than years.
Great. And then tied to that, Betta was wondering about long-term effects. Do we have a sense, have we had enough experience with this virus to know what the long-term effects might be?
I think there'll be, I mean, we don't have enough experience, but I don't think there'll be any long-term consequences to individuals who have contracted the virus. I think the biggest risk is short-term with pneumonia and as several people have mentioned, you know, overwhelming the healthcare system in the near term.
Great, thank you. Any other questions?
Hi, this is Melanie from Baltimore. Can you hear me?
Yes.
Yes. No, I don't have a particular question. I just wanted to take the time and thank Raj and Chiara and everyone else on the panel to answer the questions and for the informative presentation. That's good stuff. Thank you.
Thank you. Thank you, Melanie. Anyone else on the call?
Yes, this is Karen again. Can we share this information with, or has it been recorded to share it with our local community, the answers?
Yes, I'm going to pass that question to Raj.
Hey, Karen. Yes, we are recording the video of this call. And once this is done, I'll put it out as a public video on my page. I'll put it on YouTube. At the end of this call, all the presentation materials, the links, and a link to this video is what we'll send out to everyone that had registered for this call through their emails, and then we'll also send it out to. We'll just post it online, and there were about 45 people on this call to begin with. There are a lot more dance professionals in the world than 45. So as much as we can share this with people, with professionals, it is going to be helpful. It's going to help our community be safe. I hope that answers your question.
It does. Thank you very much.
I'd love to ask something of the dance professionals. If you can do anything online, some of us would love it. We have to keep our spirits up while we're all dealing with this, and we have to think of innovative ways to bring joy to our lives. You know, maybe in Italy, they've been playing music on their balconies to each other at a safe social distance. So I'm sure you all are very creative people and can think of ways to feel a sense of community, even when we can't be too close.
Yeah, I know Beto has also a question around how, for full-time instructors, how long should we be planning before getting our dance schedules back to normal? Is it 30 to 45 days? Is it on a week-to-week basis figuring it out?
So we're recommending canceling events for 30 to 45 days and then reassessing midway as more information becomes available from the CDC.
Okay. And then Muñeca has a quick question around whether the virus is heat resistant. Could you answer that, Darryl?
Heat resistant meaning if it lands in water and you boil the water, will it kill the virus? Yes. But as we discussed earlier, the climate, it's affecting warmer climates as well as cooler climates. There are cases in southern states in the U.S. and in parts of Asia and Europe where the climate is warm. So it's not heat. Transmission still occurs even in warmer climates.
Okay, and Muñeca was saying in terms of cleaning surfaces with hot water, I think hot water alone?
I would use dilute bleach in water, a few tablespoons of bleach in a quart of water, and then just lightly wipe down surfaces is what CDC recommends.
Okay, thank you. I think we've had, recognizing that a lot of us are also self-isolated, but also having kids. This is a shout out for our DJs and instructors to consider targeting a whole new audience of parents with kids who could probably be entertained with some new dance moves.
I have 45 versions of Baby Shark. I got you guys.
There we go. But maybe we want something different than Baby Shark. But I think that said, recognizing, Nina's got 2 little ones at home. I actually taught my nieces a merengue basic step because one is 4, and actually managed to teach an 8-year-old an on 2 basic. And that helps. That helps kids. It keeps them entertained. It keeps spreading the word about dance. And I think it ultimately helps us with the community. So getting those videos out, I think, would certainly be helpful. Kelly's noticed that there are instructors who are teaching online. There's a Corona Shine Challenge going on. So search Instagram and Facebook for that. As we're coming to a close, I want to remind us of the 5 key messages. One is use trusted sources of information. And I think Darryl has said this plenty of time and Ram has as well. Go to the CDC website. If you land on cdc.gov, the first thing you hit on is a coronavirus banner, and that will give you trusted information. So please use that as a source of information. I think that, you know, social isolation is going to help us because we're thinking not just of ourselves, but also of the other people who we're coming into contact with our lives. And anything that helps flatten that curve or reduce how quickly we're spreading allows the health system to be able to respond more effectively, so that we're not seeing what Italy's seeing with patients dying in hallways because they can't get access to the doctors and to the equipment that they need. Don't panic. We're all working on this, and I think that, again, yes, it is 10 times more deadly than the flu. It is quite infectious, but people are recovering and it's not a death sentence, and we shouldn't be thinking about hoarding, or we need patience and we need time. More test kits are coming out, more medication will be available. Did I miss the other key message? Is Chiara still on? She's got her slides.
Let me share the slide again. Here you go.
Yeah.
You see them?
Yes, thank you. And then tied to that is that fifth of use your trusted sources. Yeah. And yes, the CDC website is a trusted source. All right, over to you, Raj.
I was using my superpower of talking while on mute. I'm very good at that. Yeah. Well, there are a lot of dance professionals here, dance instructors, a couple of DJs. Thank you all for joining. A couple of days ago, we had to make the hardest decision that we had to make this year, but I think it was a very smart decision. I'm going to thank Chiara for that, because she beat that into my head, and then we talked with the discussion that we had a couple of days ago really helped with that. I'd rather see my community safe and come back online and come back up, rise up, and it's just a very happy place. It's a place of escape. So maybe staying away for a little bit and doing the coronavirus shine challenge, salsa bachata, cha-cha-cha, corona, whatever helps to do this from home, because it brings us into a place of joy, is definitely going to be welcome. Thank you everyone so much for being on this call, for answering questions, for asking questions. I'm grateful.